We found out from the World Health Organization exactly what the story was going to be as far as COVID-19 being declared or continue to remain, to be fair, a worldwide pandemic. And I think for a lot of us here, and it's interesting, I heard sort of opinion on both ends today, but we tend to live in a bit of a vacuum here, right? We see things getting better here, and we assume, well, that ought to be enough reason to say, okay, let's move on. Maybe we end up with the same kind of deal we have for the flu, where a yearly vaccine would be enough to deal with it. But we forget, of course, the rest of the world's not doing as well as we are, so perhaps it wasn't much of a surprise to hear the WHO today declare that COVID-19 would continue to be considered a global pandemic. Dr. Donald VINH is an infectious disease physician and medical microbiologist at the MUHC. He's on the line right now. Dr. VINH, thanks for your time this afternoon.
Thanks for having me, Aaron.
I guess I would start by asking you if you were surprised, first of all, that they said what they said, and B, that some people question whether they would.
Well, I'm not sure I'd say I'm delighted, but I am relieved. I mean, I think as you touched on a very key point, which is that the World Health Organization has to look at the planet as a whole, all the countries. And, you know, there are some countries that are still suffering severely from COVID. And even in the countries that are doing quote unquote well, like, Canada and the United States, we're not really doing that well. I mean, we're better off than we were compared to the start of the pandemic, but we still got a ways to go.
And we're about to mark I think in fact today marks the third anniversary, does it not, of when the WHO announced that it was, they didn't use the word pandemic, but I think it was great concern. Here we are 3 years later. How do you feel about where we're at now, Dr. VINH?
Well, you know, at the start of the pandemic, we were drowning. I'd say right now we're still treading water. So we're not out of the woods yet, right? I mean, if we still look at the situation in Canada, there's still COVID infections that are happening that lead or that require medical intervention, whether that means going to a clinic or the emergency room or requiring hospitalizations or ICUs. That is still going on. Yes, we have vaccines, and they are good vaccines, but they're not quite great yet. In the sense that we need to, have them updated and get booster doses more often than we're used to with other vaccines. And what the unfortunate part of the situation here is that there are continuous emergence of variants, right? So unlike any other infections that we're used to, we're basically dealing with a new form of the pathogen on a regular basis several times a year. You put all that together and you can say, we're really not out of the woods yet.
I want to ask a follow-up, though, with respect to that. When I hear the idea of variants, and we know there have been so many up until now, from a virus point of view, if you will, is there like a timeline on how long this goes on? I think of the flu, and every year there's a different variation of the flu, but we have a vaccine for it. Is that where we eventually head with this, do you think?
Well, I have to be honest with you. I think the answer is we don't know. At the start of the pandemic, we always thought, listen, given the genome size of this virus, there's only so many mutations this thing is going to have before it either kills itself or achieves stability, right? And unfortunately, we've been wrong. We continue to encounter a range of variants that defy what we would have thought could occur genomically. Now, to be fair, not every variant merits any increase in attention. So that there will be an increase in the number of variants. It doesn't necessarily mean that we need to change our strategy. But our current strategy right now is not great, right? We have public health measures that are essentially lacking. We have no improvement in ventilation. We are dependent on a vaccine that has a finite window of opportunity or period where it confers immunity. And we have limited drugs that are available for severe disease. So what we're really, things are better, but they're not great.
My apologies for asking a very loaded question, but if we were to go back in time and say when you thought we would be done with this, did you think that at this stage of the game we would be done with the pandemic, Dr. VINH?
I'm going to be honest with you. I don't know, right? Because the only lesson that we had was to compare back to the 1918 pandemic flu, where for some reason there's been some sort of revisionist history, and we said, well, okay, after a few years, the pandemic ended. But in fact, that's actually not what happened, right? The flu strains that we deal with now on a seasonal basis are actually descendants of that pandemic flu. So that pandemic really never ended. It just achieved seasonality. What we're hoping is that at some point, either through better research or through luck of the draw, if you will, that this virus will achieve seasonality. But so far, it hasn't shown signs of that.
All right, so let me ask a question because it's interesting to reference back to the Spanish flu. So we're talking roughly 100 years ago. All the things we learned from that, here we are 100 years later, and I realize it's unfair to say we didn't handle this as best we could, but we're dealing with something brand new. If you could go back in time, to Natasha's point, what would you have done? What should we have done differently to mitigate this?
I'm going to be honest with you. I don't think that there's any one thing that we could have done. Obviously, we would, what the ideal utopian world is that the entire world would have, homogeneously implemented public health measures to try and get, this virus essentially controlled or eradicated. Realistically, that wasn't going to happen. There's too many, factors as to why that couldn't happen. And on the other hand, however, what we kind of did is shot ourselves in the foot, because a lot of places got fed up with the virus and sort of loosened public health measures, in retrospect, very prematurely, and that only led to the perpetuation of the problem rather than a resolution of it.
I was thinking that's why so many people were expecting the WHO today to say, oh, it's over, and it's really not, because they weren't interested in the actual scientific medical side of things. They're just fed up, right? And that has played a huge role. Rather than looking back now, though, I'd like to take a look forward, Dr. Vin, in terms of, the situation elsewhere around the world. Like you said, we're faring relatively well here for the moment, but we've always looked there to see what's going to be headed here. Does that mean we're in for yet another rough ride?
Well, it's certainly hard to know, but even in this country where things are quote unquote going well, we have to remember that with the emergence of variants, this has actually led to a loss of treatments available, right? So every time we used to have a category of drugs called monoclonal antibodies that we could use as one tool against the virus. Every time we've had a variant, the monoclonal antibody arm has gotten shut down. The ones that we used became essentially futile. That tells you that we're still dealing with a problem now. Globally, of course, this is going to be a major issue because, we really only have a couple of antivirals that are available to us. In terms of vaccines, we really don't have equitable distribution of good vaccines across the world. So this is going to put us in a situation where infections will continue, people will continue to get sick, people continue to travel, people will continue to transmit. So we have to make sure that at some point we do at least do the basic measures that we can to prevent infection, and that's not through vaccinations and antivirals, although those are important for disease. To prevent infection, you really need to make indoor spaces safer.
Can I ask, when I started the conversation, I said, we tend to live in a bit of a vacuum here, understandably. We look in our own backyard, we look to the U.S. and see what's going on there, and that's pretty much, the extent of our reach. What's going on as far as the rest of the world goes with COVID right now? Is it out of control in some places?
We think that things are going well in the U.S., but they're not, right? If you look at their weekly mortality rate, it's quite high. It's somewhere between 2,800 to 4,000, depending on the week that you're looking at. That's, 1 or 2 magnitudes greater than, weekly cancer deaths. So I think that we have to remember that even in the U.S., things are not going great. In parts of the world, what we've seen, of course, with China and other parts of Asia, is that when you have a loosening of public health measures, you're getting a lot of people who are sick and hospitalized and dying. And so that tells you that the variants that are circulating right now are not benign. And so, I'm glad that the WHO still has that measure in place.
Dr. Vin, as we're speaking, even we're getting texts with people saying, just that they're done and they don't want to hear about it anymore. I feel like I'd like to hear from you. Yeah. What do you say to people?
How frustrating is that for you?
Yeah.
Well, I think we have to understand that, the public and even the medical community is also fed up with COVID. Yeah, that doesn't mean that we actually pretend it doesn't exist, right? And we also have to make a distinction between, it's not black and white. It's not, emergency, measures, all hands on deck, or, apathy. Because that's right now what we're talking about, right? People think, oh my God, we had to do that lockdown. That was a one extreme measure. And now we are dealing with apathy, which is the other extreme measure. I think what we need, instead of black and white, we need to have levels of gray depending on, what's pertinent to you. So for governments, this has got to remain a priority. For the medical and scientific community, it remains a priority. For the public, it can't be something that we just ignore. I'm fed up. I'm going to do my own thing, because the reality is that it's the public who continue to get infected, right? It's the public who continues to require medical care. It's the public who requires a healthcare system to take care of them when they do. And despite our measures, we're not always successful. So in helping people who are sick. So I think that people have to realize that they don't have to panic. They don't have to live in a state of anxiety, but they do have to realize that this remains a priority.
Dr. Vin, I want to thank you so much for your time. Always love to hear what you have to say about this. Thanks again.
Thank you very much.
Dr. Donald Vin over at the MUHC, talking about the World Health Organization right now and their decision to continue to call this a global pandemic.
Yes, I really liked what he said there. We don't have to live in a state of panic, but we can't ignore it either.
Just need to be aware.